A primary focus of holistic nursing is to bring caring and healing back into our healthcare system. The first step in this process is for nurses to learn to love and care for themselves. While this may seem a little selfish, learning to care deeply for ourselves by taking the time to nurture ourselves physically, emotionally, mentally, and spiritually is absolutely essential. When we do so, we begin to realize our wholeness and we actually become a healing presence for our patients. Take some time each day to reflect on aspects of your life and your client's life. The following video will review questions that will help you along this process. These questions are helpful in guiding a nurse through holistic self-exploration. When examining and analyzing clients, these questions will also direct nurses to focus in on and become aware of individualistic characteristics that make up our patients as a whole. Holistic characteristics can be divided into 5 categories: physical, mental, emotional, social and relational, and spiritual and energetic. The first thought of holism that we will review is physical. Is your diet or your client's diet optimal? Does your intake or your client's intake consist mainly of whole and natural foods? Are you or your client receiving optimal sleep and rest daily? Do you or your client engage in beneficial movement and exercise daily? Do your breathing patterns or your client's breathing patterns promote well-being? The second thought of holism is the concept of mental. Do you or your client have a problem-solving orientation toward life rather than a victim mentally? Do you or your client usually have a positive attitude and positive thoughts towards school and work? Do you or your client have a sense of humor? Additionally, self-exploration questions involving the mental aspect of holism may include topics such as self-awareness. Ask questions such as, am I or my client objective about strengths, limitations, and possibilities? Are we able to perceive reality with clarity? A third important aspect of holism can be defined as emotional. Ask yourself if you or if your client is capable of love. Can they love and accept themselves? Can they receive and love others? Are you or your client able to have deep feelings of identification, sympathy, and affection for others? Are you or your client able to express your own truth? These questions of self-exploration will help you become aware of both your personal and your client's emotional strengths and weaknesses. The next important thought of holism is the concept of spirituality and energy. To become aware of both your personal and your client's spiritual and energetic strengths and weaknesses, ask questions such as, do you or your client engage in meditation, prayer, or introspective practices regularly? Do you or your patient know and understand love as the essence of self? Do you or your patient have a deep respect for all? Can you or can your client connect with God, a higher self, a universe, or a spirit? The last important thought of holism is the concepts of social and relational. To gain a better awareness of both your personal and your patient's strengths and weaknesses regarding this topic, ask questions such as, do you or your client engage in work that is truly meaningful? Do you or your client engage in relationships that are wholesome and loving? Do these relationships promote growth in yourself and in others? Can you set healthy boundaries with others? Take your time in addressing each of these questions. As you go through these questions, note when you get a response with a powerful no. These are the areas you need to pay special attention to. Focus on one area at a time. Create short-term and long-term goals for each of these areas that you'd like to improve. Remember to treat yourself and your patient with compassion, love, and kindness. A holistic nurse should be compassionate towards these individualistic, broad-spectrum characteristics. Go.
Hello, my name is Ashley. I'm going to be your student nurse today. How are you feeling?
Not very well. Not good.
Okay, where is the pain? Is there something I can do for you?
All over.
Is there anything you'd like me to do for you?
No, I just want to pray.
Okay, I'll give you a couple minutes so you can pray and I'll be back.